It's AC cooling down the heat. Welcome back, FHF. We got a new pod today. Today it's a special guest, my lovely girlfriend, Hazel.
That's me. Okay.
We finally got a podcast with her, but it's not about a Valentine's podcast. It's about dental hygienist. Because she's a dental hygienist.
Yes.
Yeah, give a little bit about yourself to the audiences.
Oh, I'm Hazel. I'm Asian. I don't know what to say. I'm his girlfriend. That's it. Oh, disclaimer. I don't know how to speak English, so no hate comments in there.
All right.
Okay.
Let's get started. Anyways, what got you into dental hygiene?
Okay.
Let's start from the beginning.
So, I was working at Kid Valley. It's like a food chain with my best friend.
It's a very gross food chain.
No, it's really good. They're really
McDonald's
good. Garlic
to the
fries
win.
is really good.
McDonald's to
if
the
you guys
win.
go to like the Mariner game, get Kid Valley.
No, they were good.
Anyway, so I was working with my best friend, Ladle. Shout out. And she was like, my sister's friend is a dental hygienist. We should do that. And I was like, okay, bet. Let's do it. And then we did it. I did it. That's how it started.
Okay. So
because we were like in, high school-ish. Like,
so
we're trying to
your
figure out what to do.
friend's
Sister
was a
friend.
dental hygienist first, and then she had an idea about going to dental hygiene school.
Uh-huh. And that time, I really don't have any idea what a dental hygienist is.
Did
I
you
was just,
search it up on Google?
Kind of. I can't remember really. All I remember was just like that conversation. She was just like, we should do it. And I was like, okay, let's do it.
And is your friend in dental hygiene too?
No, right now she's in art though. She's
So she left you to do dental hygiene
but
by
she's
yourself?
but she's still in dental field.
Okay.
She's in orthodontics. Yeah.
All right.
Good field.
So what school did you go for dental hygiene?
I went to Yakima
Mm-hmm.
Valley College.
And what was the step and process to get into dental hygiene school?
It depends on which school you're trying to get into. So the school that I went into, it's a community. It's not community college anymore, but they're college, and
Just like Bellevue College, right?
Oh, yeah.
there you go. Yeah. But basically, you have to take some prereqs, and then
What were some of the prereqs?
prerequisite, like which classes?
Yeah, what were some of the classes?
There's a lot. There's like the A&P.
Name a couple so that way the audiences
Okay.
will know what they're looking at when they want to become a dental hygienist.
Dental hygienist.
You know what
Okay,
I
so
mean?
if you want to be a dental hygienist, I would advise apply to all school. Every school has different requirements.
Mm-hmm.
So to the school that I went to, they require you to take all the prereqs. So, basic English, math, psychology, microbiome,
And how long
anatomy, and physiology.
of school did you go?
For the prereqs, it took me a while because I was working and I loved the money when I was working that time. So I was like taking my time, taking 1 or 2 classes at a time. But
How
if
many years
like,
did it take for you
2
though?
years, 2 to 3 years.
Okay,
Yeah.
and then on top of that, how long did you becoming a dental hygienist?
The program itself is 2 years.
So you took around 4 to 5 years.
Yeah, to become a hygienist.
That's pretty average for school in general, though. 4 to 5 years.
4 to 5 years. And the program that I had was a bachelor.
Mm-hmm.
So it's different from the associate. Because you can become a hygienist with just associate degree.
But not at your school?
Not at my school. My school is a bachelor's.
Mm.
So some school require you to take some tests. It's called TAIS test. It's kind of like similar to nursing almost. Because most of my classmates when I was in the prereqs are going for nursing. There's like me, one or two people only going to hygiene. And they only take, in my school, they only take 18 students a year. So you have to apply. If you don't get in, you have to wait again next year to apply.
Do you have to do anything to apply, like write a letter or anything like that? Letter recommendation?
Yeah, letter recommendation, essay. You need some school, the Seattle Central, they need volunteer hours. Mm-hmm. And then you need
She faked all her volunteer hours.
No, it's it's like 100 hours. Where do you even get that? No, I did it for real. And then some place require you to do interview. So sometimes what they do is like.
So you did an interview?
I did in Seattle Central. I was like top 40. I didn't get in, but I got into Yakima. So
as long
that
as
was
you
tough
got in.
because like it was like 10 people in like a panel, and then there's like 4 judges. I call them judge. And they ask you a question and they don't call you out. You just have to put yourself out there. And I'm not like that. I was just like sitting there. Everyone's like, talking about their life and shit. And I was just like, I don't know what to say. They have good answers. I don't know how to top it off. But
you can talk about. Well, you could have talked about, like, you came from the Philippines.
Yeah.
Why you're inspired to dental hygienist.
I know. It's crazy. Someone even talked about Kobe. Kobe? Is that his name? Kobe Bryant.
Oh.
Yeah, as their inspiration. And I was like, how are you even related to him? And that's your inspiration?
I feel like a lot of them BS their way.
Yeah.
I mean, that's just
and
how
it's like
it is.
that time,
you gotta
like,
make yourself look good. That's why.
That's why.
Yeah.
I don't know how to sell myself. Yeah.
Well, you sold yourself to
honest.
me.
Huh?
You sold yourself to me.
I didn't sell myself to you. You bought me.
Whoa. Hold up. So what advice would you give out to those people out there who wants to become a dental hygienist and going through the process of schools and stuff?
In school?
Besides, applying
like
to
everywhere.
What else? Like some positive ongoing
you can do it.
Okay,
Just
what
do
else?
It. Well, they require you to have a good grade.
Mm-hmm.
It's very competitive because at least a year there's like 100 something, 200 applicants, and they only take 18 people. So you really have to like stand out. And fun fact, I was actually on the wait list. I didn't actually get in. They already started a week, and then they called me.
Someone dropped out?
Someone dropped out, and I got in.
See, that's a door. That's like a door opening.
Literally. So, and then it was in Yakima, right? I'm in Seattle. So I was like because it was like COVID-ish time. So every classes was online, but clinic, of course, is like in person. So it's like 3 days in person. You have to be in a clinic, and then 2 days online. And I was at work, and I was doing like, what do you call it? The Zoom.
Oh, Zoom class meetings.
Well, I was working because I was in class, and then, literally on the day that they called me, I told my boss like, oh, I can't work anymore. And then next week, the following week after that, I had to look for like apartment to stay in Yakima. While I was doing that, I was staying in a hotel in Yakima and doing my classes and everything. But I made it. It was a hard transition, but I made it.
Okay.
Because I was already week behind.
You did make it.
Yeah, and I didn't know, like, you have to, they asked me for like a 10 grand for like the instruments and everything. Like I had to put up everything. Like,
why didn't you apply for a scholarship or anything like that?
It was too late for that. Because I didn't get in. The time that I got in, it was already started.
I see.
Yeah. And then my family kind of helped me too.
What's the biggest thing when it comes to studying about dental hygiene?
You gotta take it day by day.
And what about testing?
Just do it, basically. Testing like what? There's always a lot of tests.
Well, exactly. What do they need to do to prepare themselves ready for a test and homework?
So
And how much time they need to put in?
it depends, cause for me, I feel like it was a lot. We were taking 7 classes in quarter, and all that classes is like pass phase, and then the grading is high. Like you can't have 75. You're gonna, if you fail
75 what? Percent?
if you fail 2 classes at least, you're gonna get kicked out of the program. Like you're out.
So you have to keep your grades.
You have to keep your grades. You have to keep on the clinicals. My advice is to go day by day, because basically 7 classes, you have like homework for all of them. You have quiz every week.
So
it's
that
just
means
like-
so. Would you advise them to just focus on
What's due first?
if you really want to become a dental hygienist, you want to focus on
the school.
The school.
I didn't work.
Not focus on outside like life and stuff. Like just focus school.
School. Well, you can do
What's the
some outside.
What's the priority list on
School first, of course.
And what else? Like what if they want to? Okay.
On the weekend, and then.
What else? So no work.
That time I go to the gym a lot. So I do school, gym, and then I go back to Seattle to see my cousins on the weekend sometimes when I have time. Yeah.
What about, so if you didn't work, what about food?
Oh, that too. Well, I live by myself in an apartment. So I was like basically doing everything. I did apply for like a low income, because basically I was by myself living and I don't have a job, so I got like a EBT and then some help for the apartment. So that was nice. Yeah. So
would you recommend people to follow that same path?
I think it depends on your flow.
Or do you suggest them to find a job while they're going to school? Is it possible to find a job while they're going to school?
So every program is different. My program, we have like summer break, which sucks, because like that means all our classes are like condensed together. We get summer break, winter break, and all that. Other school doesn't have a summer break. They just go through the whole year, But it's like everything's more spread out. But they have summer classes. So during the summer, I would work like as an assistant.
Oh, as a
dental assistant. Yeah, because before getting into the program, I was a dental assistant, because I want to see what the dental field is
how
like.
the flow is and stuff like that, whether you like it or not.
Yeah.
And you obviously liked it, because now you're in the profession.
I just kidding.
Well, I mean, you liked it enough where you continue.
To continue, that's true. Yeah.
Because
it was fun. Being at school. Now I'm kind of like
over it.
Yeah, because I like learning. I like to learn new things, like growing up. I guess I just need to learn more things. I don't know.
What are ways that you can push yourself to learn new things about dental hygiene?
So the only thing about dental hygiene is you're more restricted compared to like dentists. Dentists, they have more space to grow. For hygienists, you can go to like, you can learn laser things, or you can do restorative if you're.
But you went to that convention this summer and you learned a lot.
I did learn a lot. That was
seems
fun.
like that opened a book for you.
It did, yeah. Or you can become a myofunctional therapist.
What's that?
It's like a for tongue.
For tongue?
How to position your tongue, let you beat your jaw, everything. You need that, baby. I'm kidding.
What? What is that supposed to mean?
He snores.
You snore too.
No.
She snores louder than me.
No. And then, yeah, I don't know. But like my partner, so in school you get like a partner, right? My partner, she has 3 kids, and one of them was like
doing
an infant.
dental hygiene. Like school?
At school.
How old was
That
she?
was crazy. Can't remember. I think she was 25.
So how
she's amazing. I don't know how
when
she did
people are in dental hygiene, what is the age group usually?
Our class was.
Is it like usually like really young people?
There was a young
like
people,
straight
like
from
19.
high school.
And then, but my big, she was 30 already.
Your bitch?
Big.
Oh, you're big.
Yeah, she's 30. I can't talk because I'm wearing a retainer.
No, I'm
ASMR.
just joking, babe.
Huh?
I'm just joking. I heard you.
And we have the same birthday. Isn't that crazy?
Your big does?
Yeah.
So she was 30.
She was like my mentor.
What was she doing before dental hygiene?
Good question. I don't know.
What got her into dental hygiene?
I don't know either. We don't really talk that much. The only thing I probably ask her is like whenever I need something.
So when you're in school with other inspired dental hygienists, what made them become dental hygienists?
I honestly don't know. I never asked them.
Okay, what about graduation rate? How many of your class that you went with become a dental hygienist like you are right now?
17. So we started with 18 people. Only one person got dropped out.
And then because they gave up, or they just did feel like it wasn't for them anymore?
From what I've heard, it's because her patient didn't show up. So she couldn't take the test.
She didn't get enough to her hours?
Enough time. But basically, so we have like this test on a person, like our patient, real people. And you have to take that test in this quarter and then pass it. If you don't finish that test this quarter, you have 5 weeks on the next quarter. And if you don't pass it on that 5 weeks, then you're out. All that hard work down in the drain. Yeah.
That's sad.
It is sad. It's tough. It's like your career depends on the patients. I paid my patients.
Did they ever went back, or they just stopped doing it?
The what?
The person that dropped.
She stopped doing it.
So they paid all that money.
Yeah, all that money. It's crazy.
See, I would recommend you guys, before you get into anything serious with money, like wise, with like college and school, that you really want to make sure you're able to perform the task and, you know, be able to pay off school in the future to make sure you're gonna be okay.
Yeah. And then
don't jump into anything that you don't think you're gonna be able to complete, especially when you're gonna be in debt probably.
That's so true.
Yeah.
That time, whenever we have tests, all I think is like, if I fail, then I fail.
Yeah. Well, but that's the biggest thing. Like if for me personally, I'm not into school, and a lot of people out there, I know they're not probably into school. I wouldn't be able to do 7 classes a day for sure, because I hate doing homework. I hate going to school. I mean, I guess it depends whether if I would like to learn about dental hygiene and stuff like that. But personally, like, I know there's a lot of people who are probably interested in something, but just don't really want to put that much effort, depending.
Yeah, it was hard because we were in the clinic 8 to 5. It's like a full-time job, but you're not getting paid. And then after that, you have to do all your homework.
And you do your homework, and you gotta do the test.
And that's what.
Yeah, repeat.
Exactly. You sleep, wake up again, repeat. It's like your whole day, your whole life was like. It was pretty nice because it was like COVID, and we had the Zoom class. Sometimes I would fall asleep in the class because it's just.
And then
no
sometimes
camera.
you'll be cheating.
I don't cheat. No, there's a camera when you're taking a test and audio.
What
you
about
have to
homework?
like show your whole room. Homework.
Did you cheat?
We don't really have much homework. It's mostly just tests and quiz. Yeah, a lot of quiz.
Then how would you study then?
How would I study?
Yeah, for your tests.
Quizlet. That's your best friend.
Yeah, then that's homework then.
Quizlet.
Studying is homework.
That's true. That's true. Quizlet is gonna be your best friend.
Did your school have a Quizlet, or did you?
No, we made that.
You guys
the
made it?
previous class made it, and you pass it. It's been like, I forgot her name. I think it's Lainey. Whoever you are, thank you.
Lainey, shout out.
she's like a graduate from what year, like long ago, and she passed all that Quizlet to us.
So now
Help us
let's
review.
talk about so you graduated. You talk
Right.
about the complications of homework and testing and stuff like that, and you gave some suggestion and advice. Now that you are a dental hygienist, explain a little like your process and like how you feel about being one now.
By being one,
Mm-hmm.
what do you mean by that?
Like, how do you feel now you went through all that school and trouble and then to become finally a dental hygienist? How do you feel now?
It's nice to get paid.
But like the job though, what
The
do
job,
you
I
do you
feel
like?
like
Do you like the
it's-
job? Do you not like the job? Do you think going through all that school is worth what
With
you're
the
doing right
job,
now?
It is. It's alright. I mean,
What's all right?
it's so different because like
just be honest.
yeah. I mean, this is how I feel. Everyone's different, right? Because I feel like in school we were more thorough. You know, like we give like 100% patient care.
Mm-hmm.
Like really, because we have like 3 hours with that patient, and then imagine that 3 hours being condensed to 1 hour. You have to do everything in an hour.
Well, that's
in real life, and then you have to.
well, you gotta cater to the other
Yeah.
patients too. That's why.
That's true, and I guess you kind of just get burnt out. You know, you see 8 patients a day or more, even.
and trying to rush your work within the hour,
but also making connection.
Mm-hmm.
You know, trying to build that rapport with the patient, but also delivering the best you can, and then you have to deal with financials and insurance, all that stuff. So it's so much different from the school, you know. And but I guess the thing is like
Did
now
it
there's less
did it turn
pressure
out the way that you wanted it to be from going to
from
school?
going to school?
Probably not, right?
Probably not. No, because I had to turn a blind eye on a lot of things. Yeah.
I mean, a lot of people turn a blind eye on a lot of things in work.
And it kind of gets repetitive, like every day, you know?
Mm-hmm.
The only thing that makes it different is like the person, the patient. They kind of make it fun. They either make it fun or they give you a hard time, you know?
What do you do when patients give you a hard time then?
You gotta kill them with kindness.
You don't kill me with kindness.
I do kill you with kindness. What do you mean? I'm so nice.
Nope.
But yeah, you just gotta like cater to them, I guess.
What do you do if a patient constantly complains? What do you explain to them? What is the calming process?
Well, I usually just like explain what I'm doing.
And
like,
that
the
usually calms people
situation.
down.
Sometimes or like, you know, I'll just do what they want. If they don't like being poked, then I'm not gonna poke you. Kind of thing. Even though it's for your good, it's kind of like it's hard to help someone who doesn't want to be helped.
Yeah.
You know, like I'm just trying to help you. A lot of people say I'm rough, but it's because I'm actually cleaning your teeth.
So you're saying that people who are not rough
I'm not saying
and
that.
dental
Don't say that. You should
hygienists
cut that out.
are
Cut it
not
out. Don't
cleaning
say
their
that.
teeth correctly.
No, I'm not saying that. You should cut that out.
You can't cut.
You gotta exit out.
No, exit out. Well, if you guys press
No, 'cause,
exit
like,
out,
whoever is like,
if you guys
listening
press
to that part-
press exit out, I mean, press exit out. But we don't cut in our podcast here in FHF. Well, it's your honest. Okay, it's.
Well, I don't know.
It's about opinion based, you know. It's your
Opinion,
opinions,
that's my opinion,
and
that's true.
that's fine. I mean, it's not what everyone's opinion is.
That's
maybe
true, that's true.
maybe some dental hygienist out there who works, you know, not as
Very
rough
gentle
and still does a good job.
thorough. Yeah, that's so true.
This is from your own experience and from your own opinions. So
Thanks.
it's all about your honest opinions and your honest experience.
Yeah.
But do you genuinely think that people who don't do it rough are not doing a good job? Do you think that, or
Sometimes.
Okay.
Yeah, because I work in another office, and then one of the patient was like, oh, the other hygienist was so rough. Because I know she's just, trying to she's just being, like, perfect. Like, trying to do a perfect job and blah, blah, blah. And she's like, can you not be rough today to me? And then I said, okay, that's fine. And I wasn't rough, but, like, I wouldn't say I went actually, deep, like, really thorough. Because...
what? So what do you mean by rough cleaning though? Like, are you like getting into their gums?
Yeah, getting into their gums.
Exactly.
And I have a heavy hands too, probably.
Well,
Because I'm like obsessed with like making sure everything's out, even though there's probably nothing there anymore.
I'm trying to
I don't
think.
know.
So,
What
are you doing to make it rough? Like the flossing or like
the instrument?
the instrument, like poking through it?
Yeah, like getting under your gum.
And what are you doing in that process? What are you looking for? For those out
Calculus.
one more time?
We call it calculus. It's not the math class. It's like a tartar. It's like a bacteria that's under your gum. You know when you eat that popcorn and it's under your gum?
All right, there you go, guys. If you guys ever go to get your teeth cleaned, now you guys have a little information about what they're doing. And whether they're doing it hard or light, I mean, that's up to you to determine if they're doing a great job.
But honestly, this is what I realized. A lot of people don't really know what we're doing. That you can just BS and they don't even know.
Yeah, honestly.
But we're not doing that.
I could really care less about the dental, what people do in my mouth.
Exactly, yeah. Some people just want to be there, open their mouth and get out.
I just want to leave.
Yeah.
Or I just want to lay down, just close my eyes and just get it over with.
Some people is very, everyone's different.
Yeah.
Yeah.
All right. I think that'll be a good break period. Thanks for listening in. If you guys stay tuned, I mean, we got into learning the beginnings of dental hygiene a little bit, of the study process and being in school, doing the tests, time management, and then got a little to learn about my girlfriend's perspective about dental hygiene and the job itself. Stay tuned for the other half. Appreciate you guys staying tuned, and then appreciate all the love and support that we've been getting. We unfortunately got our shorts less views than usual.
YouTube's being a big
so I mean, like, that means we need help from you guys to be sharing our shorts and videos, since YouTube are gonna be big boss meanies to us. But we appreciate all the love and support we've been getting. Yep, we're gonna be back. Thank you. All right, we back.
We're back.
We back. She's shy.
I'm shy.
But we back. I had to force her to do this podcast.
Yeah.
She was like, "Can it be 20 minutes?" No.
Yeah.
We're gonna go more than 20 minutes. We got already half an hour done.
To talk about what?
About dental hygiene.
Okay.
Okay. Actually, good thing that you asked to talk about what. We're gonna talk. I want to talk about what do you guys like are doing in the process of, your jobs? What are you doing on the patients?
On the patient?
Yeah. I want you to describe it really detail, so that way audiences will know, every time they go get their mouth cleans or whatever, they know now what dental hygienes do and then what they do while, in their patient's mouth.
So first thing we do is we review the patient's health history.
So that's like the charts and stuff like that?
Yeah, so like medications, any health conditions, anything. And then we take the patient's blood pressure. The reason why we're checking health history, because sometimes you have health conditions that can affect your mouth and vice versa. You can have some things in your mouth that can you know, that could be a sign of something.
Mm-hmm.
And then we take blood pressure because no one really takes blood pressure anymore.
No, yeah.
Usually on a daily. And you don't even know that you have a high blood pressure. It's because, high blood pressure is like a silent killer. You won't know until later on, and it's already like bad. So when patients have really high blood pressure, we usually recommend them to see their doctors. Or if it's really high, then you gotta go. Sorry,
So you can't work on a patient if they're high.
Especially if you're admitting anesthesia,
Mm.
you can't. And then after that, depending on whether the patient needs X-rays or not, we take X-rays.
Mm-hmm.
And then we
X-rays for what?
pictures.
I know, like for teeth. Okay,
Yeah.
I'm just
Oh, okay.
not for me, for the audiences.
Gotcha.
We want to be informative for the audiences,
Yeah.
so they know what exactly step by step.
X-rays.
Yeah, and
It's once a year usually.
mm-hmm.
If the patient have concerns, then or if the doctor wants to take a picture, then we'll take a picture too. And then we measure your gums. We look into your gums, see if there's
And what
any.
are you measuring for?
So we're looking for any signs of inflammation,
Mm-hmm.
or like bleeding or any irritation. And also we're doing like a oral cancer screening.
Mm-hmm. Wait, why? Before you move on, why are you looking for those things for the gums?
For the gums,
Mm-hmm.
Cause any sign of gum inflammation means it could mean a lot of things. Early sign of gingivitis or
Mm-hmm.
gum disease, what we call periodontal disease, which can lead to a different health conditions. Because your blood, once the bacteria in your mouth can get into your bloodstream, it can travel through your whole body. And it can cause, diabetes, Alzheimer's, high blood pressure, things like that. So that's why our job is basically to prevent gingivitis and to prevent periodontal disease in getting worse,
Making dental hygienists important.
Yeah.
Because of that.
Yeah. So we're preventative people. We're
preventing
anything from happening.
From endangerment from health issues. Anything related to the mouth.
Yeah. So basically, we're here to just keep you safe and just healthy. That's what we're here for. And then doctors do this too. So depending on if the doctor do it or the hygienist do it, but basically we look into your mouth, look for any oral cancer sign. We feel around your neck and your head too, or like any TMJ issues. Especially right now, HPV is like one thing that you can see in your mouth.
What's
that?
Human
papilloma virus from various things.
What can you how can you get that?
Oral sex. Yeah. Or
there you go.
There you
Oral
go.
sex. Be careful, guys.
Or like when I was in school, I volunteered in like a veteran event. So all the veterans, and when we were looking into their mouth, all of them had like a sign from smoking. Like people chewing tobacco, you can see it where they chew it, or like the burn in their palate, everything. And the thing about it is sometimes they're hiding under your tongue at the very back, and you don't even know that
Yeah.
you have a
And people don't
oral
really
cancer.
check the bottom of the tongue.
Yeah, and when I was on the conference that you were talking about earlier, I took one of that class, and she was talking about this case of like a 16-year-old. She saw that She saw I forgot what it's called, but she saw something in her mouth, and a few months later or a year later, she died. Literally
from something in their mouth.
Yeah, I think it was like an oral cancer or something, or like the HPV.
So that's why you shouldn't hate going to the dentist, guys, because they're actually very important.
Yeah, and then I actually had this one situation where I had like a ulcer in my throat. Mm-hmm. I went to the urgent care, and I think I saw what do you call that? They're not doctors, but they're physician assistant. And she gave me an antibiotic, and it was not helping at all. So I decided to go to my dentist, and she looked into my mouth, and she's like, "Oh, you don't need antibiotic." She gave me an antiviral because it was actually a virus, not the bacteria, and it was not in my tonsil too. It was just an ulcer around the throat, and that actually helped more than me going to the urgent care. Yeah, because she knows more about the mouth
than the people. At the urgent care.
At the urgent care, which was horrible. Because I was like dying. But not literally dying, but struggling.
So did you list everything that you do for patients?
Oh yeah, sorry, I got sidetracked there. So after we do assessment, we go on to discussing with the patient about their oral hygiene at home.
About brushing every day, flossing every day.
It only takes 2 minutes or 3 minutes, and you'll be surprised what that can do for you. It really makes a difference. That 3 minutes of your time in a day. Good for you, good for me. Makes my life easy too. Because, less stuff for me to do. And then depending on what you need, we may do like a regular cleaning or a deeper cleaning. Or you might need some irrigation to minimize the bacterial load, or some laser. And mind you, everyone has different bacteria in their mouth. Some are, depends on your genetic. Sometimes you have more bacteria that's more active than the other, so you're more prone into getting that. And yeah, fun fact, you can actually pass cavity from kissing, sharing spoon and stuff.
Yeah.
Because it's bacteria after all.
She passed it to me.
Yeah, he gave me cavities.
No, she gave me cavities. She's a dental hygienist, gave me cavities.
So be careful who you're kissing. Watch out in their mouth. If they don't brush or floss, be like, ew.
Yeah. There's a funny story off topic. When we first started dating, she asked if I had any cavities first. And then, yeah, that was the most funniest moment I
did ask you that?
Yeah.
Really? When?
When we were after we were kissing, you're like, "Oh, do you have any cavities?"
And the funny thing is, like, my eyes usually direct to people's teeth. Usually. Yeah. To see if they're dirty or not.
I told her not to do that.
Yeah.
To me.
Yeah.
Even though she does.
Yeah. Yeah.
So that's very informative for any of you guys who are going to the dental office and seeing your dental hygienist, getting your mouth cleaned and getting checked up. Now, you explained why it's important to go to the dentist. Why is it important for them to go to the dentist?
Why is it important?
Yes, say the part again. Why is it important?
Oh, because your mouth is connected to your whole body. That's like the entryway for everything. And I think you guys know that. That's where you eat and everything, right?
Well,
so
a lot of people, you assume that a lot of people know, but like why? Like you also know that a lot of people are avoiding the dental office.
Are. I don't know why you guys hate us. It's okay. We hate you guys too. I don't know. I mean, I was a patient like a couple weeks ago because I had a cavity. Thanks to who?
No, that's you.
No, it's because
she doesn't clean her retainers.
It's hard to have retainers. Oh my god. I'm a bad patient too. Anyway, it was not fun having someone like in your mouth. I have a small mouth. And they were like trying to put everything in my mouth. all at once, and I was like, I couldn't breathe. I was gagging, and I guess it makes sense for some people, you know, why they hate it, but it's really important. It's the same thing as, you know, getting your checkup with a doctor. You guys gotta get that scheduled once a year.
That's true. I mean,
You know,
like you said, you know, dental hygiene is important because, you know, what's entering your mouth can affect your whole health. And also what's building in your mouth can affect your whole health. So it's important to get checked up to see if everything is clean and good
it's not
and
just
healthy.
all about smile.
Yeah, it's not about white teeth all the time.
Oh my God, those fake teeth. Have you seen those?
Yeah. Anyways,
Crazy.
it's not about any of those. It's about your actual health.
It's about your
it's
health.
definitely, you know, having white teeth and it's part of it and all that, but it's
And a good smile.
yeah, majority is about your health too.
Yeah, it is about your health. Yeah, because my instructor,
Thomas, did you learn a lot about dental hygiene?
Yeah, speaking of which, I really need to go.
There you go.
I actually have a quick question related to it.
Oh, okay.
For people like me, could I get like free dental checkups? Because I really need to get my medical and my dental situated soon.
Oh, do you not have insurance?
Oh, I have medical and I don't have dental insurance.
Oh, gotcha.
And I'm trying to figure that out pretty soon.
There is an event in Seattle Center where they do like a free dental care.
Oh, really?
Yeah, like for 3 days straight. Or you can do like, you know, the neighbor care.
Oh, yeah.
I think they do it
that.
for like a cheap, lower price.
It's like a little bit.
Yeah, it's like a government.
On your income too.
It depends on your yeah, I think your
Oh,
income. Yeah, for the neighbor care.
Oh, yeah, that makes
From
sense.
what I know.
Mhm.
But like the private practices and everything, you need insurance.
Oh, I see.
And I think at least in my office, we have like this program where you can sign up. Like you pay $100 something a year.
Oh, yeah.
And then you get like a discount for everything.
Oh, nice.
Yeah.
Sounds pretty good.
Yeah. So it's pretty good, you know.
That's good to know, yeah.
Yeah. I mean,
There you
it's
go,
your
Thomas.
health, you know.
It's so long, I really
Make your
do need
appointment.
that.
Are you inspired? Are you inspired now to get your dental
Yeah,
hygiene
I'm still
going
scared,
on?
But I'd rather get it over with.
Yeah.
'Cause the longer
Well,
I wait-
now
the longer I
you
wait, the scarier
now
it
you
is.
learn
Scarier,
that
yeah.
you learn that how important it is to get your mouth clean and checked too.
Yeah. And we
Get
don't
it over with.
judge. People
Yeah.
always think that they have to brush and floss right before the appointment. Don't even.
I'd rather do it a month in advance, like every day.
Mhm.
Oh my
Be
gosh.
more consistent right before my test.
Right.
Yeah, so it doesn't hurt
A
as
lot
much
of
when
people
they
do
floss,
that.
Yeah, because I'm gonna bleed like hell when I floss.
Yeah.
Because they do it kind of rough.
Oh my gosh.
sometimes.
Bleeding is not normal. If your gums bleed, it's not healthy. And I have some patients who doesn't bleed at all. I wish I can
Alright.
show them to like people who bleeds. Like, look at this guy. Really doing a good job, you know, kind of like that.
Mhm.
Like this.
What?
That's
But you
how
gotta
your
explain.
gums looks
You
like.
gotta explain why it's not healthy to them. Why is it not healthy?
To bleed, because
Mhm.
it's a sign of there's a bacteria in there.
Mm-hmm.
There's something causing the irritant, causing irritation. It's kind of like you're getting when you get bit by a mosquito.
There you go, Thomas.
You know,
you hear that?
your
Yeah.
skin kind of get bumped, right?
You hear that,
red.
guys? It's important.
reddish.
Important to listen in about this topic about dental hygiene. Not if you want, not only because you want to be one. I mean, it's also if you're like a patient going into the dental office and not knowing
Yeah.
what's going on majority of the time and trying to avoid the dental office. This is the reason why you should go and get it checked
Yeah.
up.
Oh my gosh, and not just dental hygiene.
Mm-hmm.
Because you're there to get checked by the doctor too, right? To see if
exactly.
you have cavities and stuff or infection.
Mm-hmm.
Because I was reading this article. This one patient died from infection.
What type of infection?
Just a root infection that the bacteria went to the brain
Mm-hmm.
and just died.
There you go.
Yeah. I like her, you know. I mean,
This
anything
is not
can
to
go
scare.
wrong
This
with
is
that.
this is not to scare any of you guys, but it's just it's really. I hate to repeat myself because it's really important to just check on your health.
Yeah.
Even though this is why a lot of people are skipping dental hygiene and going to the dental office because you guys are not informative about some of these informations. This is why the FHF podcast steps up and then share these information to you guys from professionals and from people's experiences and their knowledge. and their opinions. I mean, obviously we have a profession and experienced person here telling you guys about why you should go get it checked up, clean, and then also for those inspiring dental hygienists too, why it's important for you guys to do a great job on your patients.
Exactly.
Because people's lives are on the line. You can never be
perfect, though.
Yeah.
The good thing about dental hygiene is no one's gonna die on your chair. That's why I love the job. Nursing versus hygiene. I think hygiene is better. Love the nurses though. Thanks for what you do. It's a tough job.
Now you explain your job and you explain what you do and what people should look out for. Mm-hmm. My next question is, what is up for the future? Becoming a dentist?
Huh?
What is up for your future? Being a dentist,
I don't know. We'll find out.
Do you want to be a dentist?
Not right now.
Do you think about being a dentist?
I thought about it. I had a thought about it. Actually, when I was getting into the hygiene school, when I didn't got in, right? I was on a wait list. I was like thinking about just doing the prereqs for dental school instead.
But you say you like to learn and expand.
I do. So
what if you're fully profession dental hygienist, learn everything, know everything?
I might either expand into being a dentist or expand into a different career. Yeah. Okay. I'm not sure. We'll find out.
And what advice do you have to those out there that are already a dental hygienist?
What? To the ones who already are licensed?
Yeah. What advice would you give out to them from your experience?
I don't have advice. You probably know what they're
doing. What inspiration words then?
Just do it.
Just do it? Are you a Nike commercial? Just do it? You can't steal their slogan.
No, but
we're gonna get copyrighted. Just do it.
That's true. But okay. Just get it over with. No, but that's for everyone, even the student.
Okay.
If you're holding off to take your licensing exam.
What? Okay. What advice would you give to those who are aspiring to be dental hygienists then?
That's the one. That's my advice. Yeah. Because don't overthink it and just do it. If you fail, then do it again. Because when I was taking the exam, you'll never feel ready. Mm-hmm. You'll just never feel ready. You just have to do it.
I mean,
or else you're just gonna keep pushing it off.
You guys gotta step out your comfort zone and just do it. I mean,
you can't keep pushing it off.
As you could tell, a lot of the podcasts that we've done before, a lot of our guests, they like to step out their comfort zone just to do what they want to do. For example, previously we got a podcast with an actor named Hebron. Stepped out of comfort zone to become an actor. Here he's at becoming an actor.
Yeah, and another example, I got out my comfort zone to record a wedding shoot last week.
There we go. And Thomas is out here recording weddings and then now editing it.
Yeah.
And then Big Bro Amp, he went to an AI consultant, got out of his comfort zone to learn about AI and stuff. He's not big on technology, but now he's learning more about AI, and now he can take advantage of that and consult to businesses. A lot of these things are just to really step out your comfort zone and just get it over with. Not just do it, because I don't want to get copyrighted by Nike. Just get over with. Yeah, we'll get an upside down check and then just get it over with. Yeah.
Props to Nike though, because that code is really true.
Yeah, it is.
You gotta
just
really
do it with a check mark.
Don't even think about it. Just do it.
Also, off topic. Stay tuned. We got a lot of interesting stuff for FHF plan. This coming Wednesday, you guys won't even know time frame right now because we're trying to post within months in advance right here. But Wednesday we got a frisbee pod going on, and then we got next week we got a rugby player. So we got a lot of sports this month, And then we got Thanksgiving special going on. Stay tuned for that. We're gonna get some FHF merch wearing on soon. So every pod we're gonna wear it, so that way it's imprinted on us, and you guys have to be reading FHF all the time. Get it in your head. Yeah, and then we're gonna get a poster soon.
Oh, with your pictures?
No.
Oh, yeah, I think you guys should do
that.
that.
To fill in the empty space.
Yeah,
gotcha.
We're not a boy band. Also, we're not only that, we're trying to get onto Spotify, so stay tuned. I know I heard a lot of you guys saying like, oh, I want to like be listening to it and not watch a whole video and be able to exit out YouTube. I hear you guys. I'm gonna make it easier for all of you guys and post it on Spotify. Just stay tuned for that. I mean, maybe it might come out in season 2, who knows, but stay patient with us. I hope Thomas has all our audio from our previous pods, because that's important.
I could just convert video to audio.
Okay, that's true. Okay, there we go. We have something figured out. Do you have any questions, Thomas? I know you're behind. So by the way, I know Thomas behind the scenes right now, but I like to involve, the behind the scenes to make it more interesting. So do you have any questions?
I did ask one of my important questions I had.
Yeah.
I do need to do a checkup,
right?
Because it's been years.
Yeah.
But, I'm trying to think.
If not, then it's all good.
Yeah.
Do you have anything else to say, babe?
I don't know. It's a good career. Get into it. Good schedule. Good pay. Just burn out. That's the only thing. You get tired dealing with people.
Her hands get tired too.
Oh, my hands get tired. My neck and my back.
Yeah.
But
also, it's important to get a good glasses, right? Because
that's an investment. So you gotta make sure your ergo is upright. I feel like that's not just in dental. That's for everything. When you're working in a computer, make sure you're not slouching and everything, because that's gonna affect your whole body. Yeah, and being on the phone, your neck is
What were you saying,
I
Thomas?
have a funny question. Have you ever witnessed like a little kid screaming and running away from the dentist because he's so terrified? 'Cause I've seen that stuff.
I've had one when I was in school. Guess who it is? Zia. My niece. I brought her into school, because one of the requirements is to have a kid, and she ran away and she was crying. Oh
so
my
you did
God.
a bad job?
No.
You did a
she
bad
got
job
scared
on
of my
your knees.
friend, because my friend, she's not a giant, but she's just really tall. I don't know if you've seen her before, Val. She's so tall. And Zia's this tiny, and you imagine looking up to an adult. I don't know, but she came back. We got her back, and got her teeth.
Did you bribe her?
Stuff. Did I bribe? I think I bribed her. You gotta bribe all the kids. I think that's
all right. So
Arya cried too.
My girlfriend's quote of the day is "Just do it." I appreciate all the love. I appreciate you guys stay tuned for this podcast. Desmond's out today, but we're gonna get him back soon again. Like I said, please like, subscribe, share with your friends, family, dogs, pets, whatever. We got a lot of stuff going on. Season 2 will come out on February, right, Thomas?
Yeah.
19th.
New season.
Yeah. New season will start. We'll probably get more new unique stuff on set.
Kind of wrapping up
we're already kind of wrapping up around this season. We're just trying to post as much pods. I'm gonna go on a trip with my lovely girlfriend here in Japan. Yeah, we're gonna be in Japan. We might have little vlogs, so stay tuned for that too. I appreciate you guys, and we out.
Peace out.